Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on Emphysema. Now, first of all, what is the meaning of emphysema? What exactly the emphysema is? Now, the meaning of emphysema is equal to blown up or full of air. Now let's try to understand this thing, blown up or full of air. In the figure I am showing you this. For example, over here, this figure you see. Now what this figure is, so in figure A, the healthy lung is shown, and in the lung the cross section of alveoli are shown, and this alveoli that I have shown you in the figure, these alveoli are small and they are having the thin respiratory membrane, or the thin wall of alveoli is present. So here these are all the alveoli in the cross section they are showing, and right now I am showing you the wall or the membrane of the alveoli. So here we are looking this, as you can see, these walls are very thin in healthy individual. Okay, now in emphysema what happens? So so in emphysema, the alveolar membrane or the alveolar wall, they break down, and neighboring alveoli they join together, and they are forming the larger fewer alveoli, and on the surface there are less number of blood capillaries are present, and since the alveoli wall is lost, so the surface area for the gaseous exchange is reduced. So here in the figure you can see that, let's say earlier here the alveoli wall was there, here there was a wall, here there was a wall, but now all the wall they have disintegrated. Okay, and the remaining wall of the alveoli, they merge together, and you can see the large spaces are formed, and these spaces are filled with air. This exactly what happens in the emphysema. So in emphysema what is happening, that the walls of the alveoli, they are destructed, they are disintegrated, they are broken down, and neighboring alveoli they join together, and they are forming the abnormal large air spaces, and these large spaces they remain filled with the air during exhalation process. So as the wall of alveoli is lost, there is lesser surface area available for the gas exchange. So what happens? The O2 diffusion across the respiratory membrane is reduced, and that's why in the patient's blood the level of O2 is decreasing, or it is somewhat lowered. So in the figure I am showing you this thing. We have seen this thing earlier. So in this figure, as you can see, all the alveoli are shown, and one alveolus we have zoom, and you see this one is the blood capillary, and this one is the alveolus. So the wall of alveolus and the wall of capillary, they are in very close vicinity, they are in contact with each other, and they are forming the respiratory surface or the respiratory membrane. So already we have discussed this thing, the cells which are present in the respiratory membrane. So this wall or this membrane is degraded. Okay, so the wall is lost, and see over here in this figure, let's say we are disintegrated this wall, we are we are breaking down this wall. So what happens once we remove this wall? So the remaining wall of alveoli adjacent or the neighboring alveoli, they are going to join each other, and they will form a large space which is filled with air. Okay, so and here you see what is happening, that in the alveolus the atmospheric air is present, and from atmospheric air oxygen enters into the capillary, and from the capillary blood CO2 enters into the alveolar space. But since this wall is lost, the gas cannot diffuse. Okay, so that's why the level of oxygen somewhat lowers down in the patient's blood. Now, as there is a scarcity of oxygen in blood, so when the patient performs any mild kind of exercise, that time patient's body requires more oxygen, especially the muscle cell, and oxygen patient is not getting sufficient supply of oxygen because there is no sufficient gaseous exchange is taking place. So that's why the patient becomes breathless. Okay, and as the more and more alveoli walls are damaged, so what happens, the lungs, they lose the elastic recoil. Now the lungs elastic recoil means what? See, when the inhalation process occurs, we know that the size of lung is somewhat increases. Lungs are enlarged. Okay, and when the exhalation process is taking place, that time lungs are returning back to their original shape. Okay, so the returning of lung to their original shape, that we can say the elastic recoil. But here in the emphysema patient, lungs are unable to come back to their original state. So the property elastic recoiling somewhat reduced in the lungs of emphysema patient. Okay, and why this lungs are losing the elastic recoil property? It is due to the decrease or the loss of elastic fibers. Then um, as the large air space are formed due to the merging of various alveoli, so in the lung what happens after the at the end of exhalation, uh, very large amount of air becomes trapped in the lung. So we can say, in other words, we can say the emphysema patient cannot expel out the air from the lung in the atmosphere. So, so his or her situation is problematic. Problematic means he is unable to expel out the air which is filled, which is trapped inside the lungs. Okay. Now, if this problem continues for many years, okay, then added exertion during inhalation increases the size of the chest. Let's say a person is suffering from emphysema from 1 or 2 years. That time there is a possibility that the size of the chest can increase. So the chest become the barrel chest. So what is the meaning of this barrel chest? That, see, barrel chest refers to an increase in the anterior posterior diameter of chest. So increase in the diameter of chest, and the appearance of chest resemble the shape of a barrel. So so many a time, most often, this character, barrel chest, is associated with the emphysema patients. Okay. Now, why? What are the reason why this emphysema is occurring? Why it is taking place? What are the reasons? So, emphysema is generally caused by long-term irritation. Irritation due to the uh, air pollutants or various type of dust. Okay, so or the allergens. So due to this, patient suffers from emphysema. Then the cigarette smoking, okay, air pollution, person is working in industry, so the occupational exposure to industrial dust, these are the most common irritants which are responsible for emphysema. Then emphysema also occurs due to the enzymatic imbalance in the person's body. So enzymatic imbalance is also the reason for emphysema to occur. Now, what are the treatment for emphysema? How emphysema is treated? So, one way is to cessation of smoking. That means the smoking habit immediately it should be stopped. Then removal of other environmental irritant means the air should be clean. So with the various instrument, the environmental air, the pollutants, they are removed. The air should be filtered, it should be clean. Okay. Then exercising, training under careful medical supervision means the patient is advised to perform certain kind of exercise under the supervision of the doctor. Then some breathing exercise are performed. Then use of bronchodilators. Now the bronchodilators are kind of chemical which are inhaled by the patient, and this bronchodilator, they are dilating, they are enlarging the air passageway or the respiratory tract, the organs of the respiratory tract, they dilate due to the bronchodilator, so the patient can easily breathe. Then the oxygen therapy is performed on the, so additional oxygen is supplied to the patient's body. Then now this thing, once again, emphysema. What is emphysema? Emphysema is a progressive degenerative disease Progressive means month after month and year after year, the problem is increasing. That is the meaning of progressive. And degenerative, here the degeneration means related to breaking down of the alveolar wall, loss of the respiratory membrane. That is the degenerative disease. And in the emphysema, there is a destruction of the alveolar wall. Now, as a result, what is happening? Cluster of small air sacs merge into large chambers, and due to which, as the alveoli have merged together, there is a decrease in the total surface area of the alveolar wall. Okay, and as the surface area is decreased, so there is less gaseous exchange between the alveolus and the pulmonary capillaries. Okay, then at the same time, the alveolar wall also lost their elasticity. Okay, and capillary network, the pulmonary capillary associate with the alveoli, they diminish. Means the number of pulmonary capillary is also reduced or decreased. Now, person who is suffering from emphysema is finding difficult to force air out of the lung because the person has lost the tissue of elasticity, the tissue which is responsible for elasticity or the elastic recoiling of lung, that tissues are lost in emphysema. So person requires abnormal muscle effort to compensate for the lack of elastic recoil. That means lungs are not returning to their original state or to their original size. Okay, and lungs have enlarged because the extra additional air is trapped inside the lung. So the person has to make effort. To make an effort means the with the respiratory muscle, a person is pushing his lungs, and by doing this, energy is utilized to push the lungs for the exhalation. Okay, now here 2 million people are there in United States, and among these 2 million people, 3% of the total population who have emphysema, they have inherited. Inherited means they are getting this disease from their parents, and majority of other cases of the emphysema are due to smoking and exposure to other respiratory irritants, let's say the pollutants or the dust. Now what is the treatment? So experimental treatment for severe emphysema is lung volume reduction surgery. Now, what is done in lung volume reduction surgery? So, as its name suggests, this procedure, lung volume reduction surgery, this procedure reduces lung volume, and due to this surgery opens collapse airways, means collapse bronchiole, collapse bronchi, collapse trachea, larynx. So all this collapse organ, they are dilated due to this surgery, and person can now easily breathe. Okay, so this is how they are performing the surgery, and this is how this surgery is helping the patient. And due to this surgery, it seems that the person's lung functioning has improved. Okay, and the person's quality of life also improves. So here one more figure I would like to show you. On the left hand side, comparison of lung tissue. In figure A, normal lung tissue is shown, and figure B is showing that emphysema has developed. Now, alveoli calls coalesce. Now, alveoli coalesce means what? That means forming larger chamber. So here in the alveoli, you will find that there are small air chambers are there, but here in the emphysema patient, what happened, the alveoli walls are lost and the alveoli walls are merging. So due to that, the larger air chambers are formed. Okay, and coalesce means to come together to form one large group or substance. So here who is forming the large group or substance? So the alveoli are forming the large air chamber or large air space. So this is about emphysema. Okay, these are the figures we have seen that, and this information, this is from the third book I have included. So first few points are overlapping, we have already discussed. So the remaining points we are discussing now. Okay, see, the alveoli gradually expand, adjacent alveoli merge to form large airspace supported by fibrous tissue without alveolar capillary network. Okay, then as the elastic connective tissues are lost, compliance increases. Now, what is the meaning of compliance? See, compliance. Compliance refers to the distensibility of an elastic structure, such as the lung, and is defined as the change in volume of that structure produced by a change in pressure across the structure. So here in this case, what happened inside the lung, as the alveoli walls are destructed, as the alveoli walls are lost, the small alveoli they merge together, and they are forming the large air space. So huge amount of air is remain trapped in these air chambers of alveoli, and person feels it difficult to exhale this extra amount of air. So due to the air pressure, the size of the lung increases, and the lungs they lost the property of elastic recoiling. So it is very difficult for lung to regain or to return their original size. That is the meaning of compliance. Okay, so compliance is increasing. Then loss, due to the loss of respiratory surface area, oxygen absorption is less, so the person becomes short of breath. Okay, so breathing process, inhalation exhalation becomes difficult. Now as the person is getting less amount of oxygen. So to get more oxygen, the person's respiratory muscle have to work hard. And as the person is using more of his respiratory muscle, so that means person is using lot of energy for the breathing process. Okay, and as lot of energy is used, person tend to become thin. Okay, person become thin because he is using large amount of energy in the breathing process. Now in the right hand side, in the figure I will show you the chest x-ray, and in the chest x-ray you will find that the lungs are over expanded. Lungs are large in size. Okay, and why these lungs are over expanded? It is to maintain the normal blood oxygenation. Okay, so here in the figure the chest x-ray is shown, and here you see the lungs are over expanded. So they are very large in size in emphysema patient. And why they are large? Because the air is trapped, and they also want to absorb more oxygen from that trapped air, and exhalation is difficult. So they are using their respiratory muscle, and as they are using their respiratory muscle, more energy they are using, and as they are using more energy they become thin. Okay, then the skin of emphysema patient becomes pale. It is a pale skin, and this pale skin, the color of pale skin is usually pink. So so here in the emphysema, the combination of heavy breathing, combination, this thing we are remembering, in emphysema patient, the combination of heavy breathing and pink coloration of skin together, both this condition, they are given the descriptive term pink puffer, pink puffers. Okay, now pink puffers means these people, the emphysema patient, they are using their respiratory muscle largely, and their skin color is pink. So that's why these people who are suffering from emphysema, they are known as the pink puffers. Okay, so now treatment of emphysema. So the cigarette smoking should be avoided. Okay, then causes, see, environmental pollution is considered the main causes of respiratory disease. Then various type of dust, metal dust, mineral dust, then sawdust. Okay, sawdust and mill dust. Okay, so mill dust means various kind of grains are grinded, and in the sawdust, so the wooden industry. Okay, then mineral dust and metal dust. So this type of dust also irritate Also, these are also the reasons for the emphysema to occur. These are the irritants, and here you see this one is the these are the alveoli, okay, neighboring alveoli, and this wall is lost, okay. So the wall of alveoli and the capillary is shown. So in emphysema present, let's say this wall this wall is destructed. So once this wall is lost, what will happen? Here there will be large air space or air chamber, and in this chamber so much air is trapped. Here also, okay, here also this respiratory membrane is lost. So as the wall of alveoli is lost, this process, diffusion of O2 and CO2, is that process becomes difficult in emphysema present. So so the oxygen level goes down in the emphysema patient. Here also, if we remove this this wall, what will happen? There will be a formation of large air space, and in that space so much air is going to trap, and this process, diffusion of oxygen and carbon dioxide, this process becomes difficult. So with this we have completed this presentation lecture on emphysema. I hope you have enjoyed this presentation lecture, and I also hope that this presentation lecture will be helpful in your exam preparation and also in your studies. My name is Manish Koshti sir. I am from Ahmedabad, India. Bye bye. Namaste.